Part 3: Treatment and techniques for premature ejaculation and controlling orgasm. Fortunately, during last a decade, medicine has progressed a lot, especially in premature ejaculation. And nowadays we have many medication and many drugs, and naturally or artificial, that can help for premature ejaculation. The problem with medication is that they don't attack the root of the premature ejaculation, and just they are as a painkiller for pain. They don't cure the problem, just temporarily change the set point of the orgasm. And not only that, we have to take every time we want to increase our premature ejaculation time. It has some side effect too. Actually, in if we look at our body, how it works, in each of those activity of our body, from toe to head hair, all of them, billions mechanism is running at the same time. And for each activity of our body, we have a set point. That, for example, blood sugar is a set point at around 100 milligram per deciliter, or heart rate, blood pressure in each person has been set up, because there are, for each of those activity, there are thousands neural circuits that they work together and has been set at specific level, like exactly thermostat in our AC room temperature that we set up at a specific temperature. Our all activity in our body, each of them has been set up in a specific point. For those people with premature ejaculation, that set point has been dropped and is out of the control. For better understanding this set point of the orgasm, let me give you an example. For example, those people that they are athletic and they are good shape, with exercise, that is behavior, exercise and good diet, their set point for heart rate and blood pressure dropped. Most of the time their heart rate goes around 50 to 60, and blood pressure around 100 to 110, 20. For those average people, heart rate will be set up around 60 to 70. And for a little non too much healthy, that they don't have very active lives, they have sedentary life, or a little older, their set point for the heart rate and blood pressure goes higher, around 50, 70 to 80, and blood pressure around 120 to 130. So our body set up and regulate whatever we needed based on our behavior. Our behavior determined how much each of those activity set point will be. The orgasm, sexual activity and orgasm has its own circuit, neural circuit, and set point. In those patients with uncontrolled orgasm, lack of the control, or they have premature ejaculation, that set point has been disturbed and dropped to lower level. For understanding how it works, that is the way the system, the sexual activity work, is that the combination of behavior and thought determined how our neural system and circuit work for the orgasm. As we know, our behavior is result of our beliefs and thought. Whatever we think and we believe, we feel the same way and we act the same way. For example, very easy to understand that. Imagine those many parents, based on their moral and principle and value, they are ready to die for their kids. Just very simple, just based on their beliefs and thought, or those soldiers, or those very high level of the human activities that they think they have some responsibility. They are ready to sacrifice themselves for other people, or in negative way, those suicide bombers, they are ready to die and kill other people just based on their beliefs. They think there is a God, and the God ordered them or gave them responsibility based on the brainwashed. By brainwashed, their beliefs, and they got to that level from their bottom of their heart that this is good things. Other people they are gonna kill, they are devil, and they go to the hell, and themselves God reward them, and they give them God give them another better life in another life. That is the brain, human brain work based on our beliefs and our thoughts. We feel and we act, volunteer or involunteer. The sexual activity and orgasm is the same way, based on our all experience and development personality during childhood, that we know over 80-90% of our personality, our thought, who whatever we think, whatever our principle and value are in adulthood, is come from our childhood. And after during adolescence we have a chance that with the interacting with other peers and other source, we have the chance that we improve ourselves or change if whatever has been damaged during childhood. That is the way our personality developed. And most of the time, our behavior and our thought is at the level of subconsciousness and unconsciousness. Whatever we act and whatever we feel every moment, every hour, every day, all of them has been embedded in our brain and body at the level of subconsciousness and unconsciousness. For making clear what does mean subconsciousness, unconsciousness. Unconsciousness, you can imagine those natural feeling like the fearing, scaring of the suddenly burst of the sound. Suddenly we jump. We don't have any control. It is established genetically in almost all animal and human. This is unconsciousness. We can later we can have control because our brain has that power control. But the first reaction is completely unconsciousness. The next level we come under control. We can control if we scare, act, or no. There is not danger, and we can get over the situation. Subconsciousness is at the level that usually we act automatically their way, that way, but still we know and aware of that activity. For example, after we learn, for the beginning, at the beginning of learning how to ride the bicycle, we have to put all our energy and mind how to balance our body, how much we have to put left side, right side, how to hold our hand, and how bends this way, that way. All our body focus and attention on the balancing and moving on the bike. But when we learn it, it goes to the subconsciousness. We don't think, after we learn, we don't think anymore about how we act over the bike. We just get over the bike and running without thinking about how we are doing, thinking, watching other, talking, focusing without thinking. So that is subconsciousness. In the sexual activity, and orgasm is exactly working the same way, based on the our beliefs about the gender, about the sex, about the everything that related to the sex. it's come to work in our sexual neural circuit. And in those people, their beliefs and thought in some way causes that set point drop down, and they lose their control over the orgasm. That is the way the system work. That is the reason the best approach for treatment and management of the premature ejaculation and control our orgasm is that we have to approach multi-dimension from different aspects. One of them is our thoughts and beliefs. Our thought and beliefs, we called it cognitive therapy. Another is our behavior, how we act. That is a sex technique. The technique we use it, our behavior. That we are going to talk about these two aspects too. And finally is medication. So in many studies show that the ejaculation time just with the medication only increased 2 times. If the person had ejaculation 1 minute or 2 minutes, with medication the ejaculation time will be 4 minutes. But in those people that they use those all three aspects, cognitive therapy, behavior therapy or technique, sex technique, and medicine, their ejaculation time increased 4 to 8 times. So, and it will, they, most of them, they can get control over their orgasm. That is the point of the management, that we attach the root of the problem and change our set point of the orgasm. So one of the most important that many people they forget or they don't have, they don't take it serious, is cognitive therapy. The cognitive therapy is that by helping a professional, especially a clinical psychologist, they can approach exactly those reason or root of those negative thoughts that affect our sexual activity and lack of the control. They can find by just by dialogue whatever during every day we feel about it, it affect us, it make negative or positive. With that dialogue and discussion, when and with the help of the psychologist, especially clinical psychologist, logic thought come, and unlogic thought and discussion, and we can little by little fix those negative and unhealthy thoughts. As we know, all of those thoughts and beliefs has been established in during our life, from our childhood, even from womb, genetic factor, up to today, this time. All of them has been established and anchor in our personality. So that is not that in one day or one night or 1 month we expect to fix those problem. Just keep in your mind. You can approach two-way with help with a specialist or yourself. Go and find it with a study and pondering every moment of your life that you feel negative or positive, and with a study finding those keys and moments and logic and reasoning for all of them, we can little by little, if we repeat it during months, every day, months, little by little, those mindset and thought and thinking will be changed permanently, not with one night. Just don't. That is the reason cognitive behavior therapy usually take time, because we are going to establish a new neural circuit. Neural circuit doesn't, most of the time, doesn't form in one night or one time. It takes time with repeating, exactly like the those skill we learn, that new neural circuit form. The thought and behavior is exactly the same way. If you want to help yourself by yourself and you don't think you don't have time, or you don't want to go the clinical psychologist, there is some way you can help yourself, and that is that when for one time, at least one time in your life, sit by yourself and list all your principle and belief and value, all of them, values and principle. You think those is bad, good, wrong, right, whatever it is in your life that is your guideline for living, how you behave every day, how you feel every day, and ask yourself, is that right thinking? Why? And go study. But why the other people that they don't have the same belief I have, they are bad? Why? Why I should? Why God order to some people that do this way? Why? What is the reason for that? Why, if somebody tell me I am overweight or fat, why it cause I get nervous, angry, or depressed? Why, why this is bad? Why this is good? What is the reason? And finding logic. Is that any logic for that beliefs and for those principles and for those values? If you do every day everything that come to your daily life, every moment, and you can list it and search it and pondering and find the right and correct answer for that, in that case, your belief and your thoughts will be changed. It doesn't matter which way. The same way that you had, at least you find a logic and you believe strongly with all evidences and knowledge, not just based on the whatever we learn from the media, family, friends, environment, school, college. It's not that. It's that we find exactly right answer. That most of the time there is not right answer or right answer. There is something between them. We don't have in our life too much bad or too much good. Most of the things are between them, except some very strict rules, principle. Everybody is the same. We are human at the same level. We have some people at some level, they act badly, but generally they are good people, but they act wrong. Most of the people, they have good intention, but some of them, because of the some experience or their situation, they act badly. So based on all of them, we can change little by little those negative and wrong beliefs and thoughts that affect all aspect of life. And if not, is take time is the best way. Get a help with the clinical psychologist. It help in the long term a lot, and I am sure your life will be completely different. At the beginning maybe disturb you, find out that some of your beliefs and thought and value is wrong, but after a while and stick and take it serious little by little, if your psychologist is good at his or her job, little by little you will experience a new and almost positive and good life. Now let's go for the sex technique that we use for premature ejaculation. I forgot to mention, later in other lecture, I will go over all those this thoughts and mindset of the people that they have, especially those people with the premature ejaculation and lack of the orgasm. Among them, for example, one of them is perfectionism. The perfectionism or all or nothing thinking is very common among the people with this problem, and with those people have depression or anxiety disorder or other negative thought, that overgeneralization or mind reading. All of them I will talk about most of them in different clips. Now I am going to focus more on the sex technique and finally to the medication. Next clip, I'm going to talk about sex technique. And after that, we go over the medication. Please, if you thought it was useful, share it. Up to the next time, have a wonderful time.